Here's the question. A female patient comes to you after recently having undergone a syphilis test. Her test came out negative. She tells you she has had multiple partners recently and frequently does not practice safe sex. Which of the following screening test values would you be most concerned with in her case? Sensitivity, specificity, positive predictive value, negative predictive value, or accuracy. So you have a patient with a negative syphilis test, and that's important because so what you see from this is that you already did the test and the test came out negative. So that means that we're looking for something that's a post-test value, meaning it's either positive predictive value or negative predictive value. Now, which would you be most concerned with? Since her test came out negative, basically this question is asking what would you be most concerned with? Well, in this case, you would most likely want to know how confident can I be about her test. So I would choose negative predictive value because since her test came out negative, I could truly find out is she truly negative or not. So the correct answer would be negative predictive value. If her test had come out positive and it asked me what I would be most concerned with, then it would be positive predictive value. And this is the next question. An elderly male patient came to your clinic with complaints of urinary infrequency. On examination, you notice a 1.3 centimeter nodule on his prostate gland. You order a PSA and his result is PSA of 8, and the normal PSA is usually below 4. So the PSA screening test has a sensitivity of 70% and a specificity of 80%. By the way, these are just made up values, so don't take them. You know that in your country the prevalence of prostate cancer for his age group is 15%. Is also made up value. How likely in percentage is it that your patient has prostate cancer? Well, so what do we know from this? So we know that you suspected him for having prostate cancer. You did a PSA and his test came out positive. So he already did the test and came out positive. And you know that the sensitivity is 70%, so that's given to us. Sensitivity is 70% and specificity is 80%. And also they told us that the prevalence is 15%. That's interesting. How likely is it that your patient has prostate cancer? So first you have to figure out what you already know and what you don't know. So these are the things that we know. And we know that he has a positive test result, of course. Now we got to ask ourselves, what are they actually asking us right now? Since the test came out positive, they're asking about how likely your patient has prostate cancer. That means how likely is it that the positive test is actually truly positive. In other words, they want to know what is the positive predictive value in this case. So you're looking for positive predictive value. So that's what we have to calculate. These are the things that are given. And now how are we going to do this? Well, we have to work backwards and we have to make a table. And here's how we're going to do it. So here's our table. What we're going to make for the table. So here on this side we're going to put the test results. So positive test results, and here negative test results. And we're going to see the diseased people here. Diseased. And here we're going to have healthy. Okay. So what do we know so far? We know that the prevalence is 15%. And sensitivity is 70 and specificity is 80. Well, prevalence, first of all, is basically just the people who are diseased overall, all the people in the population, right? So in this case, since prevalence is 15%, let's talk about prevalence, which is 15%. What we can do is we can take any set of individuals as our population. So let's just go for 1,000 people. So let's say our population was 1,000 people. So if 1,000 people was the population and the prevalence is 15%, I want to know how many people are diseased. Because remember, prevalence is basically diseased over the population, right? So in this case, since 15% is the prevalence, all we have to do is we do 0.15. So what we do is 0.15 multiplied by 1,000, because 15% of the 1,000 people in our population are actually diseased, and if we do that we get a number of 0.15 multiplied by 1000. We get 150. That means our total diseased people are 150. So we have 150 total diseased people. Now they could either be true positives, because remember these are the true positives, and here we have the false positives, and here we have the false negatives, and here we have the true negatives. So these 150 people represent all of these, and now what we have next is sensitivity is 70%. Well, we know that sensitivity is all the people who were actually diseased, the true positives over the true positives, plus the other people also who have the disease who are the false negatives. Well, in this case, we know that the true positives and false negatives are going to equal to 150 in our given scenario with the total population of 1,000 people. Right? Population. Okay, so that would mean that if we were to calculate it, then how would we do this? So that means that we have a number on top over 150, right? Because true positives. So all I did was, instead of my true positive, instead of x, I'll just keep it as true positive to make it simpler. True positives over all of these people who are diseased, which we know is equal to 150. And we know that if we calculate this, it's going to give us a percentage of 70%, which is basically 0.7. So now all we have to do is solve for true positives. It's basically similar to if instead of true positives there was x. So x over 150 equals to 0.7, solve for x. And the easiest way to do that is, what you do is you take 0.7 and you multiply it by 150. And whatever answer you get, let's see, what is the answer that we get? 0.7 multiplied by 150. That gives us 105. 105. That means that the true positives is 105. That means our true positives are 105. So what would the false negatives be? Well, then obviously the false negatives would be 150 minus 105, which would be 45. And we can confirm that because 45 plus 105 is equal to 150. And if you check the sensitivity as a percentage, sensitivity would be true positives, which is 105 over all of the diseased people, which is 150. So 105 over 150, and you will get a sensitivity percentage of 70%. And we do the exact same thing over here for specificity. But how do we know all the people who are healthy? Well, easy, because we said that 1,000 is the total population, and since 150 of them are diseased, the ones who are healthy are just going to be 1,000 minus 150, which is going to be 850 people. And the specificity, again, same thing over here, what we do for specificity. So very similarly, which is basically true negatives over true negatives, plus the false positives, and since we're solving for true negatives, over the total amount of people who are healthy, which is true negatives plus false positives. In this case, we know it is 850 in this given population. Okay, and we have to solve, and we know that this number is equal to a specificity of 80%, so 0.8. Now we just have to solve for true negatives. Again, this would be 0.8 now. Simple math here, multiplied by 850, and that is going to give you a value of, let's see, 0.8 multiplied by 850, 680. Okay, that means that the true negatives would be 680. True negatives, not the false positives, the true negatives in this case here would be 680. And so the false positives would just be 850 minus 680, which is the remaining people, and that would come out to be 170 people. Yeah, and if you add both of these together, 170 plus 680, that would give you 850 people, which is perfectly correct. Good. And if you check the specificity, which is basically the true negatives over all the people who are healthy, meaning 680 over 850, then you would get a specificity of 80%, or 0.8. So this is our table. And if you can't understand the math of how to calculate this and everything, it's as long as you get up to this part where you can write this down, then all you're asking yourself is, what is 80% of 850? And what is 70% of 150 in this case? And that's basically, that just means 0.8 multiplied by 850 and 0.7 multiplied by 150. So now we have our table. That's perfect. Now we're looking for positive predictive value, since the test is positive. Of course, if the test had been negative, then we would be looking for negative predictive value. It would be the same thing, except after we calculate, after we drew the table, except our calculation for the negative predictive value would be different, because the formula would be different. So positive predictive value is the true positives over true positives plus false positives, because again, these are all the people who had a positive test result. So now we know it's really simple. We just plug it all in. 105, which is our true positives, over true positives plus the false positives, which is 170 in this case, and that would give us 105 plus 170 is equal to 275. So now 105 divided by 275, that's going to give us 38%, or 0.38 or 38%. So our positive predictive value in this case would be 38%. That would be the answer. So as you can see, if you work backwards and as long as you know the formulas, and as long as you know, not even the formulas, all you have to know is the actual definitions of the terms, you can just work backwards and redraw this whole table and figure it all out. It becomes really simple then.